Well, let's begin to focus on self-injury. And let's start with an example. Young lady named Julie. She's at a sleepover with other adolescent girls. Julie is dared to do what the other girls are doing, which is basically hold her arm over a candle and burn it. She does it, and she gets this kind of sense of a strong, good feeling. And, a month or two go by, and Julie has a big argument with one of her closest friends at school. She's under a lot of stress, and she knows what she's going to do. As soon as she has access to another candle, she's going to burn herself, and she's going to get the sense of relief. We're going to talk in a few minutes about the theories of self-injury and exactly why students do it. But let's imagine for a moment Julie's teacher the next day sees burns on her arms or sees a bandage. Julie reaches for something. She sees her forearms. And by the way, the forearms, the thigh, and the stomach are the most likely places that young people use to cut, burn, scratch. Now, what do we expect a teacher to do if she sees a fresh cut on a student's arm, or if she sees Julie with a burn on her arm? Well, we really want a teacher to work as a team with other school personnel. If she's comfortable, she could talk to Julie privately and ask about what's happened. I know many times young people have said to me, "Oh, my cat scratched me." Well, rather than confronting that immediately, I'd talk a little bit about, well, how often has that happened? What could we do so that that wouldn't happen quite so often? So if the teacher did approach the student, we'd want her to do it privately. And we want the teacher to work in combination with the nurse or the counselor. And more about what the team at school should be doing later. By the way, the term self-injury or this behavior has gone by a multitude of different terms. It's been called deliberate self-harm, self-mutilation, self-injury. The most commonly accepted one today is NSSI, non-suicidal self-injurious behavior. Now, another term that has been used is repetitive self-mutilation. And some people believe that the term self-mutilation is too harsh, because really what we're talking about is a moderate and a superficial wound or injury. It's not intended to permanently mark the body, or certainly not intended to cut off a body part. Well, who engages in this? And today, in the time we have allotted, we're going to really be focusing on, and I'll put it in quotes, normal young people. These are not young people that are below average with involved intellectual capabilities. They're basically average intelligence or above, and we're going to look at why they engage in self-injury, exactly what the behavior does for them, and how we might be able to treat it. Now, very importantly, we need to look at a definition. Perhaps the most commonly accepted definition is repetitive failure to resist the impulse to hurt one's body physically, but without suicidal intent. In fact, sometimes people will say, oh, there's two types of young people. Those that are suicidal, and over here we have those that engage in self-injury. Well, today I want to talk about that in terms of a continuum. And we cannot automatically assume that a kid engaging in cutting, for example, is not ever going to become suicidal. There are several associated diagnoses that often go with self-injury. The most common one is borderline personality. In fact, self-injury is listed as one of, I think, the 12 behaviors that a young person or a person of any age must have a number of to basically be diagnosed with borderline personality. It's also associated with mood and anxiety disorders. It's also associated with impulse control problems. And often there'll be a precipitating event, and the young person will have this incredible urge to cut or engage in self-injury, basically to shut out the argument that her parents might be having, or basically to forget about the problem that they might be having with a peer or a big disappointment or humiliation at school. And we need to understand that this is a complex behavior. It actually fulfills a multitude of needs for the people engaging in it. And don't we wish we could just tell them to stop? And by the way, that's the most common response from an adult. They're horrified. They demand that the young person stop. But it's not quite that simple. We need to recognize the struggle. We need to look for the underlying behaviors, and we need to be there with the young person for some of the ups and downs that are going to come with treatment and gaining control over this behavior. And I also believe strongly that we should also assess the person engaging in self-injurious behavior as being possibly suicidal. It has been said that self-injury is contagious. It certainly seems to be a behavior learned from other young people or learned from websites on the internet. And I know at least one of those sites has a warning. It says, better not enter because you're going to love this behavior, which basically gives us a little insight in terms of the power that the behavior has. It has been referred to as a rite of togetherness. Sometimes a young person will say to their friend, to show your special affinity and our bond for each other, I want you to engage in this behavior. And sometimes kids just do it to be cool, but if they do it often enough, it can become addictive, which is what a lot of young people have said. The behavior is addictive. Got a call one time from an assistant principal in a middle school. I've got 6 7th graders in my office. They're all talking about cutting. What do I do? And generally what we believe is there's one dominant person in the group. And by the way, SI or self-injury is usually done more by females than by males. But in the example back with the assistant principal, we might have one dominant female in the group, and we might have to think about how do we separate her from the other young girls? How do we make sure everybody gets the treatment that they need? Also, a question that people often has is, what about group counseling? Does that work when we have young people engaging in cutting, for example? Well, the literature actually cautions against group counseling, would say things like, you better be a very strong group leader. Otherwise, what are all the clients in the group going to be talking about? How much the self-injury works for them, and they may actually be encouraging each other to keep engaging in the behavior. One young person said to me, my body expresses what my words cannot. Of course, don't we wish they'd just talk about it? Don't we wish that they would write about it instead of expressing themselves through self-injurious behavior? Well, if we look specifically at schools, and then we'll talk about the role of professionals outside of schools as well, but what do we want schools to do? We want schools to be aware of this behavior. It has somewhat exploded in recent years. We used to be able to say something like this: self-injury begins and ends in adolescence. I wish we could say that. We cannot. It tends to begin even in elementary school. It extends through certainly college-age years. In fact, one of the ways that I learned a lot about this behavior is a person who's been in one of my classes on crisis intervention comes into my office, shuts the door, and talks about their struggle with this behavior. One student showed me her left arm. She said, for whatever reason, I only cut my left arm. She had over 700 scars on her left arm. Obviously, I asked her, what worked for you? How have you gained some control over this behavior? And she said, well, if I could trust myself with a razor blade, I'd get a phone book and I'd slash it to bits. But if I couldn't trust myself with a razor blade, then I would get cardboard and I would tear it. Often the substitute behavior needs to be something very active, something that provides a lot of sensory input, and something that distracts a young person during this short time period when they have an incredible urge to engage in self-injury. So we would hope that school personnel would be alert to young people that have these bandages and have these marks. We would hope school personnel would work as a team, especially with teachers, counselors, nurses, and school administrators. And we'll come to the question of parent notification in a few moments. And one of the big debates in the literature, and most people are going to say, self-injury is not really something we discuss with a classroom of students. Because if you do, you might end up with students encouraging each other, students learning about the behavior, hearing positive things about it. So perhaps the best thing I could say is a classroom presentation about the dangers of self-injury should be one that is very carefully planned. Now, we also have to look at suicide versus self-injury. Spent a long time on this. First and foremost, youth suicide is a very big problem in this country. The best national data we have says that 6.3% of all high school students in this country made a suicide attempt within the last year. You know what's really scary about that? Their parents, for the most part, don't know. School personnel, counselors, and teachers don't know. Who always knows about that are their friends. That's why it's so important that all young people understand you don't keep a secret about suicidal behavior. Now, when someone is suicidal, they're actually trying to end unendurable pain. They're trying to end everything. There is often a precipitating event. That precipitating event most commonly involves a severe argument with parents, a severe argument with friends, their boyfriend, girlfriend, some kind of extreme humiliation or a very big disappointment. Basically, as part of the definition, we said that self-injury is superficial and it does not intend to permanently harm the body, and it does not have suicidal intent. See, when you're engaging in self-injury, you're actually attempting to feel better. And guess what? It works. That's one of the things that makes the treatment something that's going to take a long time. When you're suicidal, at least at that moment, you're wanting to end all of your feelings. You're basically wanting to end unendurable pain. Self-injury is something that occurs frequently. It's episodic. It might not happen this week, but then maybe the next week is particularly stressful, and it might happen 2 or 3 times that a young person would engage in it. And typically, with regards to suicide, someone is only thinking about one method. With self-injury, sometimes there can be multiple methods with, as I said earlier, cutting, burning, scratching, pinching are the most common methods of self-injury. And also, I need to take a moment and basically separate what we're talking about today is episodic, something that happens maybe today, maybe not, maybe 3 days from now. And I want to separate that from some of the chronic excessive behaviors like the chronic hair picking behavior. That is something that literally could be happening hundreds of times in a single day, where what we're referring to is something that happens under stress. It's episodic. It might not happen today. It might only happen 1 or 2 times this particular week. Now, perhaps the best thing that I can say today is we really need to think about this on a continuum. When someone says something like, oh, there's 2 types of kids, those that are suicidal, they're over here. Those that are engaging in self-injury, they're over here. And I think the best thing is that we look at it as a continuum. And frankly, most of the situations I know well, where I know about a long history of engaging in self-injury, what finally made that behavior come to light was having a suicide attempt made. Hospital personnel, therapists, finally got to the bottom of what had been going on for a significant period of time. And perhaps the best recommendation I can make, when we know a young person is engaging in self-injurious behavior, we also need to assess for suicidal thoughts and suicidal actions. And of course, I believe strongly in our schools and communities, we need strategies to reduce suicides. We need guidelines and procedures. We also need strategies, guidelines, and procedures for responding when a young person is engaging in self-injurious behavior. Now, there have actually been a number of lawsuits, some of them against schools or even against private practitioners, when a person died by suicide and their family is questioning that not enough was done, that certain key people were not notified. Now, I actually testified in one of those lawsuits against a school system that failed to notify the parents of a suicidal middle school student, and the school district lost that lawsuit. And I think everybody has come around to understanding, you know the kid is suicidal, you work with the parents, you notify them, you transfer and hand them off to the parents or mental health officials so that they get the care and supervision they need. In fact, really, there's only one exception to that. When we know that a kid is being abused by their family, then we're going to be calling protective services. And what I don't think anybody has the answer to is, well, do we call protective services when we know a kid is engaging in self-injurious behavior, when they're cutting, for example? And that's something that we do need to continue to explore, and we need clearer guidelines from our state and our counties about that. But my strong recommendation is that if you know a kid is engaging in self-injurious behavior, document it, work with them. We'll talk about how to do that. Make sure the parents know and work to get the appropriate supervision and mental health services for that young person. But there's actually been controversy, and you're going to find some literature that isn't so clear about the importance of notifying parents when the kid is engaging in self-injurious behavior. But I'm going to say, notify. If they're suicidal, notify parents. If they're engaging in self-injury, notify parents. Make a referral in both situations. Know the community resources. But I want to give you an example, and that is, Florida is actually very fortunate to have the Baker Act. So we know that certain professionals can involuntarily hospitalize someone for an evaluation. That certainly is very important and very necessary when someone is suicidal. But what if we have an 11-year-old girl who has gone in the school bathroom and has cut her wrist to feel better, and she basically tells you, this is how I cope. This is how I shut things out, how I discharge anger, tension, and despair. I can give you examples where that young person was Baker acted, let out of the school in handcuffs and taken to a hospital without any real investigation or dialogue with school mental health professionals and the young person. What I would suggest is that we need to meet with the young person that just engaged in the purposeful cutting. We need to get to the bottom of what's going on. We need to work with their parents and mental health officials, and I do not think most situations would warrant being Baker acted in that particular situation. There's certainly diversity among those that self-injure. It is commonly associated with several things. With history of trauma, if you were to ask me, what's the single most likely common denominator among people that engage in self-injury, I'm going to say it's a history of trauma. That trauma might have been loss of someone close to them. The trauma might be severe family problems. It might be being the victim of sexual or emotional abuse. And it's not uncommon for eating disorders to go hand in hand with self-injurious behavior. So the main similarity is in the trauma and having difficulty processing and expressing themselves and not getting the help that they need.